SoundLife is a one-stop hearing healthcare center that focuses on diagnostic and management of hearing disorder. We offer a complete range of hearing products and solutions for both our adult and children. We strive to provide professional and personalized hearing services by our trained audiologists. Our goal is to promote hearing healthcare as a part of healthy lifestyle, and our services include comprehensive hearing tests, hearing loss, tinnitus rehabilitation, and hearing aids related services such as prescription, fitting, tuning, servicing, and etc.
My name is Alleya Cheng. I'm founder and chief audiologist of SoundLife Hearing. I'm a believer of better hearing, better life. Living in a world of sound can definitely transform a person's lifestyle and personality.
In SoundLife, we are all certified audiologists, where we follow the best audiological practice in order to help our clients to rehabilitate their hearing-related difficulties. SoundLife Hearing was founded in 2016. All the operation, management, and clinical tasks are run by a team of passionate and qualified audiologists. We carry different brands of hearing aids and few other health products to fulfill the requirement and need of our clients.
We felt the most joy when we see the transformation of a patient's life. It's amazing to see how much joy one can achieve through better hearing.
My life is much better now with my new pair of hearing aids. I can FaceTime call to my children, and so much better than last time that I can't.
Of course, SoundLife was the one that actually helped me to improve my hearing. My hearing impairment improved tremendously, and I'm very satisfied with that.
Our mission is to provide hearing healthcare as a part of healthy lifestyle, to raise hearing awareness of the public, to remove stigma of the society towards the hearing impaired, and most importantly, to empower people who suffer from hearing loss to live to the fullest with the latest hearing aids or cochlear implants.
Here at SoundLife Hearing, we are focused not only helping you to hear better, we help you through all the aspects of your hearing health. If you have any questions about your hearing, contact us and schedule an appointment today.
Good evening, everyone. Welcome to SoundLife Hearing Facebook Live. Tonight, we are going to learn another topic, which is vertigo, causes and treatment from the audiologist perspective. We are honored to invite Dr. Shasa Aziz, Principal Audiologist from Eartistic Hearing and Balance, who is specialized in vestibular management, to come and join us today. Hi, Dr. Shasa. How are you?
Hi, I'm good, thank you. Thank you, Alleya, for having me on your page and on your Balance Awareness Week.
Yeah, so Dr. Shasa, before we start, maybe you can share with us what Eartistic is doing.
Okay, so hi everybody. Assalamualaikum and a very good evening. So I'm Dr. Shasa Aziz. So maybe I could share a little bit of my presentation, just to, I was in awe looking at your video. It was so good. So sorry everybody, I'm just going to share my presentation. I hope that explains everything. So at Eartistic, let me just get let's just get the presentation up. All right,
Sure.
Can you see it, Alleya?
Yes.
Yeah, brilliant.
Yeah, I can see. Yes.
Yes, but
The
I don't think I can't see into my face, but it's fine, right? Okay,
Yes,
guys. All right, everybody. Eartistic Hearing and Balance Center is like Alleya's Center. We are an audiology company whereby we serve patients for hearing care as well as balance care. We pretty much we have about 7 branches across Semenanjung, Malaysia, and we definitely focus on audiological work, but we also do other parts of audiology, which is prevention. We have hearing screening for the workers. We also have prevention when it comes to education and awareness. We also do TV production. And when it comes to, we've talked about diagnostic, which is hearing assessment and whatnot, and also vestibular and balance assessment. And we also do rehabilitation for all of the ear issues, which is hearing, tinnitus, as well as balance issues. And this page right now is about myself, because I hope you will warm up with me as I'll be sharing more information about balance. Myself, I'm an audiologist like Alleya. And right now, we have been in the industry. Well, I've been an audiologist, I think, for about, oh my God, I'm going to tell my age, am I? For a while. But Eartistic has been in the industry for, I think, about 6 to 7 years. A little bit earlier than SoundLife. But, you know, we both share the same love towards audiology and the same love towards our patients. So, tak payah cerita banyak pasal I. So, when you're ready, we can talk about vestibular.
Sure. Okay. So maybe let's see who is on the audience. So we have few audience from SoundLife Hearing page. We also have few audience from Eartistic page and also my YouTube page. So hello everyone. Tonight we are going to share about the topic vertigo, cause and treatment. And this time we are happy to have Dr. Shasa, Principal Audiologist from Eartistic, to join us tonight. And she is not only just an audiologist, but she is also specialized and accredited by the American Balance Society, right?
American Institute of Balance, yeah.
Yeah, in managing vestibular, in actually managing balance problem. So let's talk about a little bit about our background. So Dr. Shasa, I'm actually graduate from UKM. So up to date, I have 10 years experience, but I knew that you are actually audiologists from different background. Do you mind to tell us a little bit about yourself?
Sure. I mean, the slide that I shared before was all about me. Macam malu lah nak panjang kan. But okay, since you've asked, I graduated from UCL, University College of London, and then I continued working in St. Mary's Hospital in the hearts of London, which is in the Paddington. And then I continued doing my Doctor of Audiology. It's in the university is based in US, Nova Southeastern University, Fort Lauderdale, Florida. Oof, very mouthful. Yeah. But it was the doctor was based in the UK, but but we had to graduate and do our practical in the US. So my background is a little bit everywhere. So I was in the UK a bit and I was in the US a bit, but I love traveling and I love learning from different places. And I actually went to Australia just to do a little bit more on cochlear implant. That's quite recently. So that's my background. But when it comes to vestibular, majority of my education comes from the US. And then that's when you were saying that I was accredited by American Institute of Balance, and not just myself. The company itself is actually attached to American Institute of Balance.
Yeah, actually, to let all of you to understand, actually, I mean, in Malaysia, not many hearing aid center is actually also doing the balance, and then we are very fortunate that Dr. Shasa is so passionate, and they know that there's a lack of service in this balance services in Malaysia. That's why once she have the knowledge, she also very happy to brought these services to Malaysian, and then founded this Eartistic, which offer hearing and balance services. So Dr. Shasa, let's for all the audience, do you mind to say hello to us? Let us know who is behind the scene, and then we would like to also know. Otherwise, both of us will be just like chit chatting, talking alone. So just say hi to us, and then yesterday actually SoundLife already organized another Facebook Live, and we invited Dr. Gan who is the ENT surgeon from Columbia PJ, to share with us about the overview for this vertigo causes and treatment. So based on Dr. Gan already have a very clear definition about vertigo. But before go into vertigo, Dr. Shasha, do you mind to explain to us what is actually vestibular system and how vertigo relates to vestibular system?
Okay, all right. So I'm pretty sure whoever have had the session yesterday or attended yesterday know that vestibular. Oh, well, let's just talk about vertigo. So vertigo is when someone perceives the environment to spin, right? Like you feel the sensation that the room is spinning. So that is a definition of vertigo. So you feel that symptom, right? So when someone suffers, or when someone has that experience, what is actually happening in the system? So let me go back to one step back. So we talked about vestibular, but the bigger picture is actually balance, right? So if you want to walk, if you want to jump, or if you want to go, well, literally, if you want to like do anything, standing, walking, and whatnot, you actually need to have balance, a good balance. Now, a good balance comes from a good vision, meaning input from the eye, and then good input from the ear. So the ear does not just have hearing system, it also shares the vestibular system that allows us to be balanced. Okay, and then you have to have a very good body structure. Your bones have to be fine, your muscles, your the blood is flowing properly. So all these three information, your body, your ears, and your eyes, when three of them are working fine, you will get balance. Because all these three input will go to the brain where it coordinates balance, and then you'll have balance. And then you ask, and then the question is, what happens if someone has where does vestibular disorder comes from, or where does vertigo comes from? It comes from when the ear part of the balance goes haywire. So when the input from the ear doesn't give you the right, when you don't have the right input from the ear, you will get vertigo because it's a mismatched information. My eye says differently, my ear says differently, therefore my body says differently, and therefore the brain gets confused, and that's when you get you get the vertigo. So that's when the room spins, because the eye needs to speak to the ear, but they're not speaking, one speaking in English, one speaking in French. So they obviously confusion happens, and the brain obviously perceives the room spins. Macam tu lah. Lebih kurang lah.
Okay. Yeah, true. So a good balance, not only depending on the ear, but also depending on multiple body system
Input.
that associate together, multiple input. So we have to have the good eyes, and then good hearing, and then
Correct.
a good sense. Yeah. So
this is what I was telling before. So you need to have a good visual information, good body.
Shasha, sorry, we can't hear. We can see your slide now. Can you just zoom? It's a
Can
black
you?
and white now.
Oh, is it black? Hold on,
Yeah,
I stop
yeah.
sharing. I share again.
Sure.
Okay, 1 minute, 1 second. Okay, how about now? Can you see? Is this better?
Yes.
Okay, great. So I think I'm just gonna stick to the presentation. Okay, Alleya, I'm just gonna pretend that I can do. All right. So as I was saying just now, the input from the eye, from the body, and then from the ear has to be correct. And then it will go into the brain, and then the information will go back to, for us to, continue walking and continue jumping and move on. So this is the more complicated system, which let's not go there. So let's have a look at the ear system. So this is the outer ear. This is the middle ear, and this is the inner ear. So this is where the hearing organ is, which is the cochlea. Now this is where the vestibular system is situated. We have 1, 2, 3, 4, 5 parts of the vestibular system that needs to work perfectly well on the right side and the left side. So if one of them goes haywire because of infection or any of them, that's when vertigo will happen. Okay, so like, just in case everyone thinks that the ear only has a hearing system, actually the hearing and the inner ear, which is the part in our ear, also shares the house with the vestibular system that gives us balance.
Yeah, correct. So thank you for this explanation. Hi, over here we have Tohira, Zahida, Nazefa, and also others audience. Hi, nice to have you all in this evening. So very well explained from Dr. Shasha, a well recap for yesterday topic as well. So my next question to you, may I know how is actually audiologist role in managing vertigo?
Okay, so as an audiologist, as we know, we see the patients with any kind of ear issues, right? So
Yep.
our role is definitely the assessment and definitely on the rehabilitation, at least at Eartistic Hearing and Balance Center. That's where we will approach patients. So we will
Yep.
make sure that the patient that comes in, if they have issues with vestibular disorder or even balance, we will do the assessment. We don't just go straight into vestibular system. We actually assess from the balance itself, as I was explaining earlier, because sometimes people can get confused whether the vertigo. I mean, am I having vertigo? Because sometimes it's very subjective. You think, are you spinning or is the room spinning, right?
Dizzy?
So for
Yeah.
some people, or just a simple dizziness or even imbalance or even a migraine, right? So that's when we need to assess. So we need to assess whether where is the problem. So first of all, we need to know which part of the balance is it, the eye, ears, or the body. So we will have that first assessment, and then but not stepping into the physiotherapy's role. So we have a very small part of the balance assessment, and then we will go into vestibular assessment. If the patient's issues are more on the somatosensory or even visual, we will definitely refer to either ophthalmologist or the physiotherapist. But if it is the problem comes from the vestibular system, that's when we continue doing the vestibular assessment, and that's when our first role comes in. The real, I would say, the real audiological role, which is the thorough assessment on the vestibular system. I've explained earlier that we have 10 parts of our vestibular system, which is 5 on the right and 5 on the right, 5 on the left. So you need to, our job, we will assess every part of it and to see where is the issue, because in the end of the day, patient that comes through not just want to know where the problem is, and the patient that comes through want to know, I want to get better, right? So therefore, we will start with the assessment from the balance, and then we do the vestibular assessment. Now, before we continue, when we perform the next part, which is the vestibular assessment, we also need to know whether the problem is actually from the brain or from the ear, because you can actually have vestibular disorder from the brain part, like for instance, multiple sclerosis. What else? Maybe they have like a tumor. So those things are central based, and you also have the peripheral issues like BPPV.
Or even stroke.
Yeah, stroke definitely. Or maybe it comes to peripheral, it can be BPPV, it can be Meniere's disease, it can be vestibular neuritis, which is one of the most common types of vestibular disorder. So once we know the problem, and then we will proceed to the rehabilitation, because obviously as an audiologist, we can't prescribe medication, but we can do the rehabilitation. So at Eartistic, we provide vestibular rehabilitation therapy that helps our patient that has vestibular disorder.
That's very good. Okay, so this is what your DC is doing in handling all the balanced patients, right? But may I know, Dr. Shasha, usually your patients is like directly comes to you, or they are being referred by the doctors?
Okay, so there's multiple angles of patients coming to us, but majority would be from the ENT itself, because normally patients, the right way would be from the from the ENT, and then they will refer to us. So it could be from the government hospital, it can be from the private hospitals. So that's normally where the patients come through. However, there will be word of mouth where people spread the words, and normally we will have a look first whether there's any red flags. So even if they come to us, we don't like, no, I'm sorry, I don't want to see you first, you go and see the ENT. No, we will see them probably very briefly just to make sure that there's no red flags. and then we will definitely work with an ENT. So for us, and I'm pretty sure in majority of hospitals or places that serve patients with vestibular disorder or even balance, we work in a multiple disciplinary team. So even if we're on our site or on our own, we have the ENT that we work with at every center that we have, because it's very important that we don't want to miss anything when it comes to assessing a patient with vestibular disorder or balance, for that matter.
Yeah. Okay. So maybe Dr. Shasha, you can also share with us, because just now you already mentioned that when patient come to you, before you do the vestibular assessment, you will first test the balance, right? Whether you will rule out whether the balance issue is actually coming from the eye problem, the ear problem, or even the sensory,
The
what
somatosensory.
the physical one. What is that called?
Somatosensory.
Somatosensory problem. So how do you do this kind of screening? And then maybe can you just describe a little bit, and then later we will also like to learn how Eartistic are providing this vestibular test.
Okay. Well, let me show you a picture, like a brief picture on what do we do.
Sure.
How do we do it? Hold on. Okay, so this is a picture of us doing one of the assessments. Sorry, that's me, but this is just a sample. Well, we have to assess patients. As I was saying, patient has.
So sorry, Dr. Shasha.
Still cannot see it.
Yeah, maybe you just put full screen and then PowerPoint full screen. I think it will be working the best.
Okay, better?
Okay. Yes, I can see you now. Full screen.
Yeah. Okay, great. So as you can see, as I was explaining earlier, that when we perform balance assessment, what are we doing actually? As I was saying just now, for us to have a balance, you have to have a great 3 input, from the visual to the ear and also the proprioceptor. So what we will do is we will take out one of each of these input to see whether you can actually balance yourself. So first we'll take out the visual, and then we will take out the balance by putting on, if you can see over here, the picture on the right, so we have a calibrated foam, and we have but this is a rehab on the right side. But what we will do is we will close the eyes, and then that means we take away the proprioceptor, we've taken away the visual, right? So now we are balancing depending on our ears. So those are the things that we do. So we take away all the input, and we want to see whether you are able to balance yourself. So that's in a nutshell of how we do to perform balance assessment. It's very simple. I mean, you can use a high technology equipment, but for us, we don't need that, because in the end of the day, it will show with the simple, we call it GAN sensory organization performance test. So we do that to assess the balance.
I see. That's great. Okay. So after you already assess, if let's say you confirm that the problem is coming from the ear, like the semicircular canals, or you're not sure it's the vestibular system. So what Eartistic is actually doing in helping these kind of patients?
Okay,
what kind of specific tests?
Okay, so definitely we will assess using the video goggles. We have the, as you can see here, we have the VHIT. So this is not actually VHIT, this is just an eye assessment. So on top of that, we also do vestibular head impulse test. So this is the most, I would say, a gold standard that we will perform when it comes to vestibular assessment. As I was sharing earlier, that we have 5 systems on each side. So the 3 system, which is the semicircular canal, why do we need the semicircular canal? We need to know which angle our head is actually going. Is it to the right? Is it to the left, right? Or whatever angle, right? So if one of the semicircular canal goes wrong, then obviously you will miss out some information. So with the vestibular head impulse test, which is a very quick head movement, and it's also the most relatable head movement, like how we actually perform. Because there's a lot of tests when it comes to vestibular assessment. You have the water caloric test, you have the rotational test, you have, chair, rotational chair test, you have vestibular head impulse test, you have head shaking test, you have vibration test. I tell you, there's just so many tests. But the gold standard and the standard that we will do is actually vestibular head impulse test. So because that just resembles the right head movement, the right head velocity of movement. Velocity? Did I say velocity? Frequency of head movement. So this is the most I would say we will perform to know whether either one of the semicircular canal has issues, or even all, because there will be cases that have all issues. And when we talk about vestibular disorder, it can come from literally anything, and anyone can have vestibular disorder, even a child. So performing vestibular head impulse test, it can be from someone who had a brain injury, head injury, ear injury, to vestibular infection, to trauma. So it is just pretty much anyone can have this issue. Therefore, this is the best test because it tells us which part of the semicircular canal that actually has the issue, or is the one that has been affected. So then, and the next one we will actually do is actually vestibular evoked myogenic potential, which is VEMS. Now this is to assess the other two part of our vestibular system, which is the what's it called? The saccule and utricle, which assesses, which is why do we need these two parts? Is to tell us where we are with the gravity. Are we going up, down, front, or back? So you need all this 5 system on each side, because we need to know which angle and which direction are we going, up, down, front, and back. So vestibular evoked myogenic potential is one of the assessment that we will do if the patient has, let's say, the VHIT is, well, the VHIT doesn't tell me anything, therefore it must be something wrong with the utricle or saccule. So that's what we will do, and we will proceed if the patient actually has a positive. If we cannot find from VHIT, then we will perform VEMS, because VEMS, like I said, the utricle and saccule is rarely the main issue. It's normally what normally affects on vestibular system is normally the semicircular canal. So those are the two main assessment that we will normally do, because this itself, or the ones that we've started from the beginning, will take us at least 2 hours.
Wow.
So yeah, exactly. It takes
a lot.
Yeah. So, but then additionally, I think what we've missed out is that it's so important that we also do hearing assessment.
Yes.
Yeah, so hearing assessment is actually part of vestibular assessment, because like I said before, our ear and our in our inner ear we have the cochlea and also the vestibular system. So I always say this, because we live in the same house, if you like cubit paha kanan paha kiri terasa, or like if one house is affected, sometimes the other house is, the other part of the house would.
I always like to use this description. If one person in the family having hearing loss, the whole family is being affected.
Correct. That is so true. Yes. I totally agree with you. So basically, that's what we normally do when it comes to vestibular assessment. There's a lot of other assessment, as I was saying, but the other parts of the assessment, we will have a look at what the issues are, and if the gold standard is the one doesn't give us any results, then we will do other things, because all the assessment covers from different frequency, like our hearing, which I don't want to bore our patients or clients to know so much detail. But the main thing is the first 2 assessment that we did before, what I've explained. Those are the things that we will normally do in our clinic, and I think it is also used in majority of hospitals that actually serve patients that has balance and vertigo issues.
Okay. Thank you so much. To be honest, as an audiologist myself, my knowledge about vestibular is so limited, because I think back then in Malaysia we didn't really focus in the balance balance assessment and also the management, but we focus like 90% on the hearing part. This is what I received back then 10 years back lah. So now I'm not sure about the curriculum organized by our local university, but definitely I would say that for balance for balance issue, we not all the audiologists handle the balance problem. So we always need to have someone which is like having the experience, like Dr. Shasha. Also, they have the equipment like just now what they show you in her clinic, having a special calibrated form to test on the balance part, and also have equipments like the V-heat and also the WAM to test different parts of the vestibular system. Am I right, Dr. Shasha?
That is true, definitely. Honestly, it is very. I mean, it is a journey when it comes to setting up a balanced clinic. You need to
Yeah.
definitely have the equipment for majority of cases. But normally we will see the patients holistically. So obviously we try our best to do everything lah. But like I said before, patient that comes through in the end of the day, they want to get better.
Yep.
So for me, assessment is one thing, but for me, for us, the rehabilitation is the more important part of our journey with our clients or even our patients.
So, do you mind to actually share with us how Eartistic doing this rehabilitation, the balance, or we call it vestibular rehabilitation for the patients, especially from the audiologists who specialize in this balance clinic? Because I'm sure that this sharing will be also seen by other doctors, and then they are interested to know how Eartistic can help the balance of vertigo patients.
Okay, so I don't really have a picture of how we do it, even in my presentation, but I'll just share with you what we do, yeah? So when it comes to vestibular patients, I'm pretty sure yesterday Dr. Gan has shared that the causes of vestibular disorder can be literally anything, right? It can be from accident, it can be from
And then
infection. Correct. So in the end of the day, patient that comes through wants to get better, but of course we will start with the assessment. And what we will normally first assess is the mechanical part, which is whether there's a possibility that, you know, when I was telling you about that, we have 10 parts of our vestibular system. Now, inside our utricle and saccule, let me see if I can show the picture again so that, you know, I can refresh your memory and everyone else's.
Correct.
Who wants to
I know
learn.
that from the vestibular system, what I heard is that we have 5 on the left ear and 5 on the right ear, and then we have the semicircular canals, which is the 3 parts, okay, and then the utricles and also the saccule.
Good job. Okay.
But
Thank you
I
for
don't know which part is that, and then still sometimes as an audiologist, if I want to explain about vestibular system to my patients, I will feel like don't know how to explain. Maybe can you just explain a little bit more details than me? Your
It's
version.
okay. Yeah, so let's do this. So basically just let me go through again. So here is our ear system, right? So let's go straight into the inner ear. So in the inner ear, so like I said, we have the hearing system, which is the cochlea, and we actually have the vestibular system, which is the vestibular system is this part lah kan. So we have the semicircular canal, which is what's inside this inside the semicircular canals are fluid, which is sodium and potassium. That's what is in there. And this fluid is shared as well inside the cochlea. So they both actually have the same fluid. Okay, so that's why I was saying that's why it's very important that we perform hearing assessment, because some issues like Meniere's disease we can know from the hearing level. Okay, so let's come back to the first part of the first part that I wanted to share, because we're going to go into rehabilitation, right? So or treatment for that matter. So we have the vestibular system. So you know that I was sharing this now. These parts are all filled with fluid, which is sodium and potassium. Now inside here, where there's a very I think comel sikit ni kan. So this part,
might I just share another better visual, maybe zoom in, then you can explain better.
I don't know how to zoom. I don't know how else to zoom this in, but
you can just escape and then you will see my screen now.
Okay, so you are
This one is the enlarged version.
Thanks. So this is our yes. So this is our part where you can see the utricle and saccule, right? So the
Yep.
inside the utricle and saccule, you actually have little stones. We call it. It's actually calcium carbonate. So these little stones, when some sort of impact happen on our head, those little stones can go inside these three little semicircular canals. And when that happen, obviously the movement of this fluid is forced by the stones, right? So that's actually called that issue, or that particular um, disorder is called benign paroxysmal positional vertigo, whereby the stones are inside the semicircular canal. Now, what do we need to do with that with those kind of patients? We actually have to put back the stones in where their house is. So for those patients, we don't have to go through all the vestibular head impulse tests and whatnot. So what we do is we normally just tilt the patient down to get the stones out to see whether that's the reason why the patient is having dizziness, and then we will position them so that the stones goes back into the house. So that is called for a lot of ENT will probably perform Epley maneuver. So that's the first treatment. But for us at Eartistic, we actually do Gans repositioning maneuver. But in the end of the day, the goal is simple. The goal is the same: is to put back all the stones inside the house, which is most probably utricle lah. Okay, so that's the first thing that we normally do. If the patient, doesn't matter if, let's say, the patient actually has dizziness because of other parts as well, we will fix that one first. We need to put back the stones where it's supposed to be, because even if you do whatever it is, or even if you give medication, if the stones is there, the stones gonna stay there.
Yeah.
So you can give whatever medication, whatever supplement, the stones will not go back into the house without it being pushed back inside the house. So we have a lot of patients that have BPPV do not like to move their heads because they're scared, because it's very positional. Every time you lie down, you pening. Every time you lie down, you get dizziness. Every time you change position, you have dizziness. So those are the patients that we will make sure we fix first with the repositioning. So that's the first treatment or rehabilitation that we will do. And then if, let's say, the patient has BPPV and vestibular neuritis, we will continue performing vestibular rehabilitation therapy. Now, when it comes to vestibular rehabilitation therapy, it works for majority of the peripheral vestibular disorders, like vestibular neuritis, actually majority of vestibular neuritis, which is majority of the patients that actually have vestibular disorder. We will do, and also for patients who has stabilized their vestibular disorder. So for instance, patients with Meniere's disease is a process of a 10 years vestibular disorder. It's a 10 years process, so they are always on active, non-active, active, non-active. So only when they're not active, we will perform vestibular rehabilitation therapy. Now, vestibular rehabilitation therapy, what it does is actually telling the other. So we have two ears, right? So we need to be balanced. I mean, if you want to hear, God gave us two ears to be able to hear from both sides of our head, right? So obviously, when people ask us, you want to wear hearing aids on one side or both sides? Ideally, both sides, because you want to be able to constantly activate the whole ear system, which is not just the ear; it's also the whole central part of the brain, right? So that the auditory cortex actually working. So same with our vestibular system. Normally, it works together because we have two vestibular systems, but our brain is so amazing, and God gave us such an amazing system. Now, if one goes wrong, our job is to tell the brain that the side is the one don't focus on the part where there's the issue, focus on the good side. So vestibular rehabilitation therapy's job is to do that. It's called central compensation.
Oh, okay.
Yeah. So we want to tell the brain that don't focus on the bad side, focus on the good side. Because a lot of patients that have vestibular disorder don't want to do anything. They don't want to move. They don't want to continue their daily living, because when they move, they get dizzy. But actually, fact is, patients with vestibular disorder or dizzy spells, you need to move for the brain to know where the problem is. But having said that, vestibular rehabilitation therapy is very specific to what exercise. That's why we need to perform vestibular assessment so that we know which part of the vestibular or which part of the vestibular that needs to be fixed. And then we will do a customized vestibular rehabilitation therapy so that the patient gets back to their daily activities like as soon as possible. And if it's peripheral, when I say peripheral, meaning the ear lah. If the ear is the issue, it takes about, like studies have shown people with peripheral disorder takes as long as 3 months, but as short as 3 days to get better. So for us, normally we don't even go up to 3 times to see patients. Normally, if we hit it, if we do the right assessment, or when I say right, meaning we found the problem, we can literally get the patient feel better as soon as 1 day. So
Wow.
yeah.
Just now I have a question, because you say that if let's say the vertigo is due to BPPV, then it's due to the secures have came out, right, from the
The stones.
The stone have came out. So when you perform the therapy, is that instantly will fix the problem?
Depending on how much the stones are in there. So if we manage to put all the stones in, and the patient actually listens to our instruction for the, normally patient has to go through some sort of like not movement restriction. That's just a small. We have a bit of a, I would say, rule. I don't know if Tohira is here. What do we call it? Yeah. There's a bit that we will tell patients on after the rehab, after the maneuver, you have to don't look up, and then you have to sleep at a certain angle. So if the patient actually follows the rules or follows the instruction, ideally the stones will not come back out, and normally 1 time it's done. So a lot of cases for us, pantang larang. Thank you, Atika. So there's a pantang larang after the first maneuver, and then ideally 1 time rehabilitation should be able to 1 time maneuver should get the patients back to normal if they don't have any other issues like low in vitamin D or low in some other nutrients, because it's about calcium, right? So you're putting back the calcium. So you need to make sure that the whole system is actually in place, because in place with the right holding of the stones. So those are the things that we would normally. Normally, memang 1 time would be good enough.
Wow. So this is a good news for those who are still suffering from BPPV. If let's say you have seen doctors and then doctors have prescribed you the medication, however, you yourself still very afraid to move your head. Okay. Like me, I can just move up, down, left, right, without having any dizziness or any vertigo attack. So this is supposed to be what we are capable to do if let's say we have a very good vestibular system, right? But if let's say you already find out that your system, your balance system, be it the eye, the ears, on the somatosensory, you have to, if let's say you understand that the other two, the eyes and the somatosensories, are all okay, but it's purely just like the vestibular system. In Chinese, we call it 耳水不平衡. Okay, then I would strongly advise you to go to Eartistic for the assessment and also the rehab as well. Okay, so we are so glad that Dr. Shasha offering this service, and then it's not easy, I understand, because even though I chat with certain ENTs, and sometimes the ENT doesn't really find it maybe the need to do the V-hit or the band test to find out the truth, because to them the management is almost similar. But from what I learned from you today, it's actually quite important for us to understand which part of the system is having the issue, so that you can tackle it, and then you can give the appropriate treatment customized to that patient. And then we actually, through your therapy, we can strengthen up the good side, the good vestibular system, so that that even one side you can also give
Depend
you.
on.
Pardon?
You can depend on the good side.
Yes, we can
But the
depend on
brain
the
must
tools,
know.
right?
Yeah, the brain must know for the brain to work on. What the
Okay.
my guru always say, the brain can't fix what the brain can't see. So that's
Mm.
why vestibular rehabilitation therapy is supposed to make the brain see so that the brain can fix it.
That's good. That's
When
good
we
sharing.
when we talk about like BPPV, right? Like majority, I mean, like almost everybody would have to go through it at least once in their lifetime. So
Really?
the studies says. But a lot of us normally move around anyway. So that's when the stones come back in. Only for patients who really have probably nutrition issues, or maybe the impact was big, or even the stones are big. Therefore, the stones might we need to do the maneuver a few times. So it's not probably just one time. So not everybody have that one time terus baik tu. But everybody's different. Even the other ear and one, I mean, our ears itself are very, very different from one another. So
Correct,
we have
correct.
a question. Oh.
Yeah. So yeah, I would like to invite the audience who is here. Now we have about more than 10 people stay with us, and we are so much appreciate your time to stay with us. If let's say you find our videos is very useful, please share to your Facebook or to your friends or family who, especially if you know that they have this vertigo or balance problem. So here I would like to just have a Q&A session open for all. If let's say you have any questions, feel free to ask, and then we can invite Dr. Shasha here to help to answer any
Yes.
problem. So maybe start from me first. Even though I'm an audiologist, but I still have a lot of queries about vestibular system. So my first system, my first question is that just now you mentioned everyone is having this BPPV at least once in a lifetime, right? So how can we prevent it?
Well, good nutrition would be the best.
Good nutrition.
Yeah. Good. Well, basically, we have to take care of our body. We have to make sure that, I mean, because I'm into nutrition now. So on top of being an audiologist, I'm going more towards nutrition because I love, I love nutrition. That's why. Having said that, so nutrition, as we grow older, we will lose some of our magnesium, we will lose vitamin D, we will lose a lot of things, especially, and also what we eat makes us lose. If you don't eat well, then obviously you don't keep those good nutrients, right? So let's say if you take soda, for instance, you naturally will remove some of your magnesium, some of the vitamin D and others. So you need to replenish it. So if you don't have those things, for instance, you don't have enough vitamin D, therefore the system cannot hold your calcium because
Okay.
you need vitamin D for the calcium to stay. So that's the first thing that obviously you need to make sure. And vitamin D is also very, very good for us to combat diseases. Let's not go far. We're talking about COVID-19, right? So vitamin D is so important for a lot of things, and we lose them as we grow older. And especially if you're a woman and you gave birth, you will also lose vitamin D. So that's the first thing that I would recommend for everybody to actually make sure that is actually at the right level. And also vitamin D, you can't just like simply take. I think from what I understand, you need to make sure that you take the right dosage for your body when it comes to vitamin D. And I would say active lifestyle is also very good because when we talk about prevention, it's also not just about preventing from vestibular disorder. It's also from having the right balance, because balance, you need the right when you have dizziness, the dizziness or vertigo will not kill you. What will kill someone is actually when you have a traumatic brain injury, meaning fall. So obviously what I will normally recommend patients is to make sure that you have a strong proprioceptor or somatosensory, meaning you have to make sure that your muscles are doing well, your legs are able to make you walk, your neck is able to hold your head. So a lot of exercise is very important. So again, healthy lifestyle, healthy eating, basically healthy body will definitely prevent you from having any issues. Of course, and that goes with dizziness and vertigo and balance disorder as well. But of course, sometimes you can't really prevent accidents, right? So those things you can't do anything lah. But when it comes to, if you know anybody in your family with vestibular disorder, then you need to pump up even more nutrition. You need to make sure that you have the right things in your body so that you don't get those things. And when you talk about vertigo or even balance or even dizziness, you also have the story of vestibular migraine. So again, if you have a family history of migraine, then you need to make sure even more that you know everything about migraine, because that can really affect your quality of life. If you want to talk about this, Alleya, we can talk all night, because I can talk a lot. Like, when we talk about the diseases, you can I can spend so much time just talking about BPPV, Meniere's disease, and whatnot. But yeah, that's it.
Okay, thank you so much. So the key thing is that having the right nutrition and also adequate amount as well. Just now you mentioned about like magnesium and also like vitamin D, right?
Yeah,
This is
magnesium,
vitamin.
vitamin D. I mean, there's a lot actually. In fact,
That's a lot.
there's a lot. So those are the things yang the paling obvious lah. But it depends also because it depends also the person's comorbidity. If the person actually has heart issues, if they have other issues, that can also be very important when it comes to nutrition. It's always,
Yep.
I will always go for prevention. It's always better than cure.
Agree, totally agree. We have one questions here. Hi, Yunjie. Yunjie is also an audiologist. So you see, Dr. Shasha, how many audiologists support your life? So a patient having vertigo, but he can't stop playing video games. Can doctor please advise if the motion in the video games affects the vertigo?
Okay, so okay, I'm just gonna share you my story. So when it comes to video games, it has either 3D or 4D into place, right? When I was talking earlier, our balance system is to do with our vision, our ear, and our body. So you get dizziness, or the brain gets confused when there's a mismatched information. Some people may have vestibular migraine, and vestibular migraine normally the effects come from visual, or we call it visual vertigo. So some people, let me separate it. So visual vertigo is when something moves and you feel dizzy. Okay, so it's like an overloaded of information of movement. So when that happens, for people with visual vertigo, you need to get them to do more of that so that they can become better. But patients with vestibular migraine, however, from what I understand, is that there's you have to take a medication for it. And like for myself, as I was supposed to share my story, right? Every time I'm approaching my menstrual cycle, my hormone will start playing up, and don't ask me to watch anything 3D or 4D. I will have dizziness the whole day. It will just spoil my day. Yeah.
Okay.
So but it doesn't come early in my lifetime. It comes very later in my lifetime. So so then that you can actually acquire it as you grow older. So with that, for me, I have to take medication. So again, if answering the question, can a patient having vertigo, but he can't stop playing video games? Now, if he cannot stop playing video games, I mean, it's really up to them, obviously. But if they have vestibular disorder, ideally, playing video games will make them feel better, because you are training the brain, you are training the eyes, which is
the eye.
It could be visual vertigo. That's why I would say I can't really say until I see the patient, because I need to know, is it visual vertigo or is it vestibular migraine? So again, I can't say, but if they enjoy playing video games, and again, depending on what video game as well. So if the video game keeps on moving, and ideally it should get better, because if they have visual vertigo. So yeah, so that's it. But then again,
that it's because when they play the video games, and then the motion is training their eyes also to follow. So that's why they strengthen the visuals.
Yes. Correct. So you telling your brain, like as I was saying before, the brain can't fix what the brain can't see, right? So if the problem is from visual, then the brain will start learning. Oh, I need to focus on this side because I will be more stable on focusing on the whatever ear lah. But you can also have cases where a patient has vestibular disorder on both sides.
Okay.
Okay, so on that kind of case, so we have peripheral issues. We have
Yes.
one unilateral vestibular disorder. You can also have bilateral vestibular disorder.
Then how?
So you don't have any reference, right?
Yeah. Then you have to only the eyes and the balance.
Correct. So these kind of patients, if you switch off lights, they will surely fall. Because they cannot balance without, they will, tak adalah macam terus jatuh, but if let's say if they trip, they will really trip hard because they don't have a vestibular system to actually help them. So again, having said this patient, I need to know the patient more for me to say how else can we do. So yeah. So again, if the patient has vestibular visual issues, then visual vertigo, then that is actually the best thing to do. Play more. Okay? But if they have vestibular migraine, then they're just asking for it lah, you know. So again, like I said, there might be more information that I need to know for me to say more. But I hope that pretty much explains the visual part, because obviously when you talk about video games, right? So it's always about the visual part. Again, mismatched information. Different information from the eye, different information from the ear will definitely confuse the brain part of the vestibular system. So finishing my point just now. So when someone has unilateral, bilateral, and the other issue is central, right? So a person can have unilateral. It takes about 3 months maximum to get better. But like I said, it can go as simple as 1 day. But if the patient has bilateral vestibular disorder, it can go up to 6 months for them to feel better. And it could also be they won't feel any better. Yeah,
Okay.
so these patients will be unfortunate lah. But if the patient has central disorder, it could be a lifetime of constant rehabilitation.
I see. Okay. Here I have one very key comment. Okay, from Shirley. Shirley said that I had BPPV, but ENT didn't refer for vestibular test, only physiotherapy. So this is something that we will also want to take this chance to also share this knowledge. Vestibular system, vestibular problem, not only managed by ENT, by physiotherapists, but can be also managed by audiologists who are specialized in vestibular management. So Dr. Shasha, would you like to just comment a little bit about this? Yeah.
So
how actually I would say that how actually Eartistic vestibular customized rehab therapy compared to the physiotherapies. Physiotherapy.
For us, we definitely focus 100% on vestibular disorder. So we don't do physiotherapy work. So as I was saying, that's why when the patient comes in, we have to assess their balance system first. Which part of the system that they actually have issues. And if it is vestibular disorder, we can treat the patient. So we won't treat the patient if we can't. We won't. And also we don't fix what's not broken. So if it is something that we feel that, we need to refer, we will refer. But for us, our focus is 100% vestibular disorder from A till the Z. And when I say A to Z, it's also nutrition, because that's also where I go inside as well. Also, I focus on. So we literally take the patient, we slice out, we really slice out what's the issue, and then we will refer to the right people, to our right, either neurologist or physiotherapist, or back to ENT, and sometimes nutritionist, sometimes for GP. So like I said, we don't just we work with other people, but for us, we focus 100% on vestibular disorder and basic balance issues we can rehab lah. But other than that, we just focus on vestibular disorder.
Okay, thank you so much for sharing. We have another questions, who is from Umu. And then, hi doctor, may I know how vertigo or migraine related to photosensitivity? A patient can barely open his or her eyes during vertigo or migraine. So I think one Umu also audiologist, maybe from government hospital, I think. Yeah.
Vestibular. Okay. As like I said before, balance is to do with your vision, your ear, and your body, right? So when someone has, they're all connected to our neurons, our nerves, right? And vestibular migraine patients are very much a neurological patient. So normally a neurologist would probably best to answer this question, but obviously it's because of how they are wired. People normally normally if a mom has migraine, the child probably has migraine as well. It's a very familial thing. But having said that, the question is how is related. Is definitely the wiring lah of the visual and the vestibular system. Again, migraine comes with aura. It comes. Some people come with aura. Some people don't come with aura. So the aura is the one that has photosensitivity, sound sensitivity. So for me, when I have my vestibular migraine or migraine itself, it's always light. I don't have any issues with sound. So again, I'm wired that way. So again, it's about our wiring lah. So my wiring system is like that. Therefore, it affects that way. Yeah, you can barely open your eyes because it's the aura. When it happens, it happens. And from when I learned when I was doing my doctor of audiology, we had to do pharmacology. So before when a person knows that they have any sort of migraine, they normally they know that it's coming. They actually have to take the medication because that's the only thing that works for them. Yeah. Again, that's from my very limited education. I'm not a neurologist. So again, patients with vestibular migraine, normally we will refer to a neurologist. That's why it's very important to work in a multidisciplinary team when it comes to vestibular disorder. Because again, vestibular migraine, we can do so much. We can only do up to maybe nutrition and prevention and advice, and maybe sometimes works with VRT, which is vestibular rehabilitation therapy, but the majority part of the treatment goes to neurologists because they will have to rely on medication. Because medication. Yeah. If it's really bad. So at one point when I started having my migraine, which is every time my menstrual cycle comes, I was almost like, oh my God, I feel traumatized going. Okay. I mean, like, oh my God, it's time of the month. Oh my God. And it's going to spoil my day. But it gets better for me, fortunately. So, but it was, I was struggling at least for the first 3 to 6 months. And I was like, this is how my patient goes through. Yeah. Like, it's really horrible. And I did ask one of those really experienced neurologists, and they were saying you will probably have to take some medication where you have to prolong your period. I'm like, seriously? Again, it's not my turf to answer vestibular migraine, but it exists. Vestibular migraine exists, and the best for us to refer to when it comes to vestibular migraine is neurologist. That's their turf. Yeah.
Okay. I also want to share my personal story because last time I remember I during the secondary school I went to camping, and then we went to the seaside, which is Pantai Merdeka, and then that time I was actually wearing those life jacket, and then the coach just asked us to float on the water to learn how to float. Okay. So that's one of the ways to use a life jacket, right? But after that, when I'm back to my camp, I feel that the tank is moving.
Yeah.
Then even though I'm back home, for 1 week it lasts. I feel like my hole is like moving. So is that actually showing that I also prone to have these vestibular problems?
No, basically it could be there's another 2 terms that I probably don't want to get everybody to confuse. One is velocity storage. So there is one is velocity storage of a person. So normally a child, you can get them to go on a roller coaster and they won't feel dizzy. They won't have any issues. You can get them to sit opposite on a train and they don't get dizzy. They don't have that any problem. But again, if you are wired to have migraine and all those, I mean, if you're wired that way, you will have motion sickness. But majority of kids, their velocity storage have yet to be full. So for adults like us, wait, how old were you when you went to your trip?
I think that time I was 14.
Okay,
Very young.
so at that age, normally you already have your velocity storage filled.
Okay.
So,
okay.
that can be the reason why you've become dizzy dizzy lah. But in your case right now, it sounded more of motion sickness, and the
Okay.
motion sickness, the okay, you don't have motion sickness because you tak muntah kan after that.
Tak muntah. I
But
just feel the
it's
sensation,
just
you
the
know.
wave, the wave, the not the wave, the
I just
sensation.
follow like the I just follow
Yeah,
like
the
the
sensation of
pitch,
movement. So the sensation, there's another term called multi-debarkment.
Wow.
Yeah,
There's so
so
many
multi-debarkment is when someone is you're on a boat and then you felt the whole movement and then your whole system feels like you're still on a boat, right?
Yeah.
So
Yeah,
that's called multi-debarkment, and we need to actually snap you out of it. So again, continuing day-to-day activities normally will just get you out of it. Yeah. So so vestibular system, balance system, this is a lot of things in there. And yeah, I love it though. But what you went through was actually a multi-debarkment. It's also the same as people who actually go onto the space, right? No gravity whatsoever. Come to back to Earth and suddenly you got gravity, so they will have issues as well.
Okay, that's good. So I think now it's already 10. So we would like to just end our Facebook Live here. So once again, thank you so much, Dr. Shasha, for accepting my invitation to come over here and then to share with us from the audiologist perspective, especially to share how Eartistic hearing imbalance can help people with vestibular problem or with balance problems. Especially, I would say that what the audiologists do, like from your side, is very different from the other physiotherapists or even the other professionals doing. However, we are working as a team, as a multidisciplinary. So we have the last question. So, Doctor, I leave it to you whether you
Ken.
think
All
you
right.
want to answer. Okay.
Yeah. Okay. Answering your question, no, it will not cause BBPV. So, BBPV is when the calcium carbonate stones fly or being not fly lah. It is displaced and goes inside the semicircular canal, right? So it only happens if there's force or if you have infection where the gates opened and the stones goes in. So breastfeeding will not cause BPPV. However, you need to replenish your calcium later on for sure with susu and whatnot. But you will not develop BPPV. Normally, the only thing that I would definitely can recommend you to do is monitor your vitamin D, because when you give birth, you would lose vitamin D. Now, vitamin D will cause this calcium carbonate to be flying around. And during this pandemic, we're seeing so many BPPV cases because we're not getting enough vitamin D from the outside world, which is a free vitamin D. But you can obviously take fish and whatnot for vitamin D. But some people, just want to share with you, Alleya, I actually did a genetic test just to see how good my body is with a lot of things, because I'm paranoid that way. So anyway, I just realized that my body does not digest vitamin D well. Therefore, I have to make sure that I take vitamin D and vitamin C. I don't want to share everything about myself, but having said that, it's good to know yourself. Check yourself, check your vitamin D level. That's just from blood tests. And if you want to go a little bit step further, like me, I'm very paranoid and very more than anything, I just want to know actually. Being in the medical
Actually, I
field.
also interested to know. That is,
Right.
Sometimes I saw the one that there's one time I saw the YouTube, they're promoting the test kit, and then they can send to your house, and then you just give them your saliva and then ship back to them, and then from there they can generate a very brief report. But I'm not sure what kind of DNA test that you have gone through.
I did 11 different types of DNA test. let's not run from our topic here, but yeah,
Okay, yeah.
but the best part is for me is to know like what is lacking in my well, not my genetic, but more anything like my body, because obviously I want to know what I need to take more for nutrition. That's because I'm into nutrition kan sekarang. So
Yep.
that's pretty much what I wanted to really know. But the 11 assessment can assess your obviously the cancer marker, the your hormones. Later I can share you furthermore. But it definitely is a very quick test. You just need to swab and then you send back to the lab. You just follow the instruction and you'll get your results within 2 weeks. Weeks. I think so.
Okay, that's
Yeah,
good. I
so
think it's
breastfeeding
good to
is
know
amazing.
about. Yeah.
No, I was saying
Yes.
like breastfeeding is amazing. Just make sure that you monitor, because you will lose you lose a lot of nutrition to your child, which is again the best thing ever. But just for you need to replenish. That's all.
Okay, sure. All right, so I would like to end this session now. Thank you so much, everyone. And then tomorrow, thank you again, Dr. Shasha, for your generous sharing. And
Thank
then
you.
goodbye, everyone. Just before you go, I would like to advertise that tomorrow we are actually inviting another speaker, which is a TCM, and then traditional Chinese medicine, Dr. Sky Sin from Sin Osteopathic. He will be sharing about the vertigo causes and symptoms, and also the treatment from the TCM perspective. So in Chinese.
Fun.
In Chinese, okay.
You
So
cannot
if let's
understand
say
that.
you are interested, feel free to join us. And then if let's say you would like to learn more also from the chiropractor how they can actually treat, so join our session at night, Sunday 9 p.m. So tomorrow I will have the session with Dr. Sky, which is a Chinese session about vertigo, and then on Sunday night I will have another session with the Carl from the ASAP ASAP center. So he is a chiropractor. So do tune in to our Facebook page also. So and also like and share Eartistic Facebook page, and also like and follow our SoundLife Hearing Facebook page. So doctor, there's another questions, but I think it's almost end the time. So Teva, thank you for tuning in. So we will reply via comment later. So thank you, everyone. Thank you,
Thank you
Dr.
so much,
Shasha.
Alleya. Thank you, everybody. Good night.
Bye bye. Good night.